This is the video on the basal ganglia. The basal ganglia involve several nuclei with a complicated integrated pathway. The first is the caudate nucleus. The caudate nucleus is a comma-shaped structure that surrounds the thalamus. Its shape looks different depending on the view. From the coronal cut, it is a large, roundish structure as you're cutting through the very head of it. From the sagittal plane, it shows its comma shape. Here is a coronal cut through the brain just behind the most voluminous part of the caudate, so the caudate looks like a small structure. In this view, we can see several other ganglia. Starting with the three-layered pyramid, the outer aspect is the putamen, then the globus pallidus externa, and the innermost component is the globus pallidus interna. Underneath this pyramid and the thalamus is the subthalamic nucleus and the substantia nigra, which aren't seen well on this picture. Let's go through the pathway for these structures, starting with the caudate and the putamen. They receive input from the motor cortex of the frontal lobe. The caudate and putamen send signals to two other nuclei, the substantia nigra pars compacta, with an inhibitory input, and the globus pallidus interna, also with an inhibitory input. The substantia nigra pars compacta sends inhibitory input to the superior colliculus, while the globus pallidus interna sends inhibitory input to the ventral anterior and ventral lateral nuclei of the thalamus. The ventral anterior and ventral lateral nuclei of the thalamus send excitatory input to the frontal cortex of the brain. In a structural view of the brain, starting with the caudate nucleus, the signal goes to the substantia nigra pars compacta, which sends an inhibitory input to the superior colliculus. From the putamen, the signal goes to the globus pallidus interna, which sends inhibitory input to the ventral anterior and ventrolateral nuclei of the thalamus, which sends excitatory input to the frontal cortex of the brain. This is a simplified view of the basic pathway. These pathways are important, so I will repeat the pathway from a different view. Starting with the striatum, which is the caudate and the putamen, excitatory transient input to the striatum will send a transient inhibitory signal to the globus pallidus, turning off the tonically active input of the VA and VL complex of the thalamus, which excites the motor strip in the frontal lobe. When the striatum is at rest, the globus pallidus is tonically sending inhibitory input to the VA and VL complex of the thalamus, so there's no excitation of the motor cortex. When the striatum is active or excited, the striatum sends transient inhibitory signals to the globus pallidus, shutting down the tonically active inhibitory signal to the VA and VL complex for a short time. This allows the VA and VL complex to send its excitatory signal to the motor cortex. Remember, inhibiting an inhibitor will release the activity of the neuron downstream. There is a direct and indirect pathway leading to the basic pathway we just covered. The direct pathway adds the substantia nigra pars compacta, which turns on the caudate and the putamen. Input from the substantia nigra pars compacta and the cerebral cortex to the caudate and the putamen are transient in nature. The caudate and putamen send a transient inhibitory signal to the globus pallidus interna, shutting down the tonic input to the ventral anterior and ventrolateral complex of the thalamus, which can then send a transient excitatory input to the frontal cortex. The indirect pathway also starts with the substantia nigra pars compacta, but the signals from this nucleus can trigger the D1 receptor, which is excitatory, or the D2 receptor, which is inhibitory. The indirect pathway starts with the D2 inhibitory receptors. So the substantia nigra pars compacta turns off the caudate and putamen's input to the globus pallidus externa transiently. The globus pallidus externa tonically inhibits the subthalamic nucleus and the globus pallidus interna. If you shut off the inhibition of the globus pallidus interna, and it will inhibit both the subthalamic nucleus and the globus pallidus interna. This inhibits the subthalamic nucleus's input to the globus pallidus interna. One way this pathway goes awry is in Parkinsonism, where the dopamine-releasing cells of the substantia nigra pars compacta no longer work. This cuts down the output from the substantia nigra pars compacta to the caudate. Since this is basically inhibitory in nature, the caudate increases its output, which is basically inhibitory. This shuts down the globus pallidus externa, which no longer inhibits the subthalamic nucleus. Therefore, the subthalamic nucleus can increase its excitatory input to the globus pallidus interna, which then increases its inhibitory output to the VA and VL complex of the thalamus. This shuts down the excitatory input to the frontal cortex, decreasing the output from the motor strip, causing hypokinesis or decreased movement. This disease is progressive and can initially be treated with L-DOPA, a precursor form of dopamine, and with a deep brain stimulator in the later stages. Huntington's disease is a form of hyperkinesis, or rapid, uncontrolled movement. In this disease, the cause lies in the degeneration of the caudate. The substantia nigra pars compacta sends its output to the caudate, but the caudate no longer works, so the output from the caudate is decreased. This output is inhibitory to the globus pallidus externa. With a decreased inhibitory input, the globus pallidus externa can increase its activity, sending inhibitory output to the subthalamic nucleus and the globus pallidus interna. The globus pallidus interna gets increased inhibitor input from the globus pallidus externa and decreased excitatory input from the subthalamic nucleus, so it shuts down its output. This leads to a less inhibitory input to the VA and VL complex of the thalamus, so it increases its excitatory output to the frontal lobe, turning on the motor cortex to a hyperkinetic state. This causes all types of extreme abnormal movement that the patient cannot control. This disease is progressive and fatal. There are some medications that can be used to lessen the symptoms, but there is nothing available that will change the course of the disease. The basal ganglia control motor movement in a complex and complicated way, much like working your way through a maze. This ends the video lecture on the basal ganglia.